If you experience low back pain every time you bend, then this tip is going to be really helpful for you. I'm going to show you how and why to replace your bending with hip hinging. My name is Roxanne Meldrum, and I'm a physical therapist with PT Health Academy. Lately, I've had several patients come in with low back pain where the primary trigger to their symptoms is bending. Bending to brush their teeth, bending to load the dishwasher, bending to pick up the laundry. Bending through the spine can be problematic because it adds a lot of load and compression and shear to the segments in the low back. So by hinging through the hips instead of bending through the spine, we protect those segments from those stressors that are creating pain. Learning how to hip hinge can be really challenging if you've never done it before, and especially if you're trying to learn something new while you're in pain. I find using a stick really helpful in cueing a good hip hinge. You can use a dowel, you can use a golf club, you can use a Swiffer mop handle, something that's a bit sturdy and not very bendy. You're going to take this stick or dowel and hold it down your back and make contact with your butt, your upper back, and your head. Now, if you have trouble making those 3 points of contact, then already you've found some impairments that you need to address that are going to help your low back feel better. Once you make contact with those 3 points, then you want to kind of put your low back in a position of comfort for you. So rolling your pelvis forward and backwards, you can find where is your most comfortable position for your back, or we're going to call that neutral. Now, holding your spine in that neutral position, you're going to push those hips back, allowing the knees to bend. And in that way, all of the bend or movement and the power is coming from your hips instead of being forced through your low back where it is uncomfortable for you right now. As you work in this position, these low back muscles have to work hard to maintain that good neutral position. So you may feel a little activity in your low back, but as long as it's not recreating your symptoms, it's okay to keep doing this. Now, if you do have a lot of tension in your low back, this is going to be really challenging for you and you may not be ready for it yet. You really need to reduce that tension before you start to ask those muscles to work hard. There are a couple cheats that you might find that you're doing. Let's correct those. As you push those hips back, make sure you let your knees bend. Don't let them stay straight as you push those hips back. The second cheat you may do is that as you slide forward, you are able to still, you'll see, round through your back just a little bit and still maintain those 3 points of contact. If you find that you're doing that, you're losing your good neutral position in your spine. In order to correct that, flip your hand so that you can feel the space between your low back and the stick. And that way, as you bend forward, you can see if you're able to maintain that gap between your back and your stick. Lots of people, when they're learning to hip hinge, feel like they are hyperextending as they get to the bottom of the hinge. But by doing this activity, holding that space, you're in your good neutral position. You're just maintaining that neutral position, which feels really different if you're not used to doing that as you bend. The more you practice the hinging with a stick, eventually you'll get good enough that you feel like you can do it without needing the stick to cue the motion. And then you can use that hinge for your activities that normally bother you, brushing your teeth, picking up your laundry, or loading your dishwasher. By using your hips to do that bending work instead of your low back, you'll allow your back time to heal away from the stressors that usually trigger your symptoms. If you're having trouble learning to hinge properly, give me a call. I would love to work with you. I hope you found this tip helpful. Thank you so much for listening.